All right,
Yay.
we are live and we are recording right now.
Hi, everyone. Uh, on behalf of GDPA, this is our first talk show series called Buka Mulut. We have Dr. Jaren here as the host and moderator. And we have our special guest, Dr. Ng Wee Loon. Thank you for joining us, Dr. Ng. Or should I just call you Dr. Wee Loon?
Just call me Dr. Whelan.
Okay, thank you so much. Because today we're gonna just talk about dental photography, but specifically in line with photography when it comes to ortho treatments as well as ortho cases itself, and how we actually take ph photographs for our cases before starting, during, as finishing. And yeah, welcome to GDPA's first series. Thanks for joining in, guys. Glad to see there are a few people. Okay, all up to you, Jaren. Go ahead.
Okay. Hi everyone. I'm just gonna keep it very casual here. Welcome everyone to our first GDPA talk. And today's topic we're gonna be talking about photography in related to orthodontics. So we're not gonna really talk about ortho much more of photography and why is it important um to how we record our cases and why we record our cases. So I am Dr. Jaren. You can just call me Jaren. Anytime, anyhow you like. I'm a general practitioner in Perak. And I've been practicing for, is this the 10th year?
Wow.
Or something like that. Yeah. So
Years.
damn. Anyway. Yeah, so I'm also practicing with dentistry, where we have a group of dentists together doing our best treating our patients, and I do have orthodontic cases, and I do have a special interest in orthodontics, although um, I'm not an expert, but yeah, we try to do our best. And I'll be showing some of my records, old records or anything like that. So for those who have a very good eye in photography, don't quote me, okay? Just bear with me. And some cases are not mine. I'm just showing you an example of why we need to take
Disclaimer.
good photography, okay?
Disclaimer is very important.
Yeah.
Disclaimer. Yeah. Yeah.
I'm not teaching orthodontics as well, okay? Just sharing slides of how pictures can be important.
But basically, today what we'll be talking about is dental photography in orthodontics itself, right?
Yes, that's
Okay.
right. Yeah.
Okay.
So learn from my mistakes and hopefully we can all take back something lah. Okay.
Okay.
And Dr. Wilun, thank you for being here with us as our special guest. As Shana has introduced to you, would you like to talk? Just add a little bit more about yourself.
Me.
Uh,
Oh, we
No,
loon.
Wilun. Yeah.
me. So I had my bachelor's from PIDC, then worked in the government and private practice for about 4 years before I furthered my study in the UK. Then I got back 2023, started my visiting locum practice in KL and JB, and currently teaching orthodontics in Metaden.
Okay, that's great. Yeah. So okay, in regards to, since you mentioned teaching orthodontics in with Metaden, I'm pretty sure that it's very important for us to have very good photography, because me as a more senior dentist, overseeing a few of my associates, we do have our own study group as well, where we go through each other cases and try to figure out what's going on and try to come up with the best solution, or correct things that are not done right or anything like that. So I think in regards to that, even photography is very important, whether or not it's in the whole general dentistry, I think photography is very important. So I'm going to show you, okay, you as a teacher, I'm going to start by showing you. We talked about GDPA already, right? Have we? Okay. So I'm going to show you a few compiled pictures, right? From people that who are kind enough to share their cases and learn, okay? And then maybe we can comment on that and see the difference later comparing to ours and yours. Okay,
Okay.
so here we go. Okay, if everyone can see my screen right here. Okay, so this is like a consultation case that was brought to my attention and asking me, okay, what can I do? So from here, I think everyone has the same reaction to what the heck is going on.
Is this your case?
No, okay, this is not my case, all right. I'm a little bit better than
So
at
this is
taking
not
pictures.
your
Maybe I
finger
started
lah.
off. No, this is not my finger. Okay, mine is white because I don't wear nitrile glove. I wear latex.
How do you correct the anterior crossbite on the 2-1?
I don't know. Okay.
You don't know?
Wait.
Okay.
All right. I
I'm
don't
just
know.
curious. I'm just curious.
Right. Yeah. So this is and I mean, I think this was maybe a few years back by one of my associates. So anyway, we are talking about photography here.
Is
Yeah.
he or she still working with you?
Yes, definitely. And we have greatly improved.
Okay. Or probably need to attend a dental photography course.
Yeah, for sure. Yeah. So from here, I think we even had a conversation on this that we'll come to it later. All right. So for the pictures on the left side is one case, and the pictures on the right side is another case.
Okay.
So obviously there is no use of retractors, and the only retractor used was on the right side for the frontal view. Okay, and we can see a lot of blue color retractors.
Yeah.
And I don't think that blue color retractors are really helping much either. Yeah, but I know when I bring this up, right, though, I mean, I think this is very applicable to a lot of people where they say, okay, I got no time to take the picture. I just ask my nurse to retract. I take, and then that's it. So the result comes in like this. So if we were to relate to consultation where we bring a case to you, what would be your comments be first?
You mean if you were to refer this case to me?
Yeah, let's say, okay, I want to consult you on the case, right? Then I send you this picture.
Okay. So the
Yeah.
first question that I will ask is, are the images flipped? Because you are using Buka mirror and occlusal mirror, so I don't want to confuse myself unless you have shown me a study model or a intraoral scan.
Okay. Yeah.
Yeah.
So
that's the first question that
okay.
I won't really go into like the quality of the photos because not everyone can afford a DSLR with a good light. So, but at least he has taken an effort to take the photos and show me. So I think it's okay.
Okay lah.
Yeah.
So at least, so what you're saying, we don't, first things first is okay lah, they took photos lah.
Yeah.
Okay.
Rather than texting and say, doctor, I have a case. It's the anterior crossbite, but then no photos, no x-rays and nothing. So at least this is something.
Okay. That's good. All right.
Okay.
At least we got
Okay.
that first step.
Yep. So even though it's not my case, even if you ask me whether this photo is split or not, so those who are compiling photos for the first time, I think this is one thing that a lot of the common mistake that they did not do is photo flipping.
It is very important.
Yeah. So if we look from I think in both cases also I think there are photos that are not flipped.
Yeah. Not flip.
Yeah. So if we take, I can use this cool whiteboard thing on our Zoom. If we see the frontal view where there's no mirror image, the crossbite is on 1-1. And then obviously I think from the occlusal on occlusal view here, it was mirrored. and it shows
Data.
here 2-1.
Yeah.
Yeah.
Although I think we can figure out when you have done quite a bit, you can figure out whether it's flip or not. But sometimes it's just make our life easier to tell your colleague that these photos aren't flip or things like that.
Yeah. And I realized that usually the upper pictures are easier to tell whether it's flipped or not, but the lower is a little bit harder because if right now we don't know whether the lower is flipped or not, so
Yeah, sometimes
it's a little bit hard to tell. Yeah.
yeah.
And like let's say from the picture on the right side, this tooth shows that it is 3-2, but from the frontal picture it seems to be 4-2. Am I right?
No, the frontal photos is 3-2.
3-2, sorry, but the
and
lower
4-2.
occlusal is 4-2. So yeah, so you can see that. But then if you look at this one here, then you see this one is 4-2. But this one is the mirror image, so I guess this was a flip. So it get very confusing, right? If we are not putting the photos properly. So
Very.
yeah.
And I
So
actually don't quite like that.
yeah, because if we were consulting it, then we have to flip it in our mind and then say,
Yeah.
okay, this tooth needs to go like here and there. And then you can see that the high canine is on the 2-3, and then from the closer picture, this is a 1-3.
Yeah.
Yeah. So important lesson number 1 in dental photography for orthodontics is this. I think if for us, it's very easy to compile it, but I think it will be a very hard time for whoever that we are consulting to to determine a lot of things from here. So anything else that you will notice or anything else that you would change, like improve from this?
I would use a proper retractor. You can get it from Shopee, I think, for less than 10 ringgit. It's just to get rid of those blue gloves. Then I would mirror and flip the images accordingly rather than having it this way. And I will crop the images properly as well. Try not to include the nose and the nose hairs inside the photos.
This one, yeah.
Yeah. Yeah. I think that's
Yeah.
How about the angle of the occlusal pictures actually, Wilun?
that's a very good question because sometimes, especially in kids, right, they cannot really cooperate that much. But I guess this patient is quite young because it's quite old already. We can already see the 5 and the 7. Depending on the mouth opening, the angulation actually take practice because sometimes myself I still cannot get the angulation right.
Right.
Yeah.
You need good cooperation from your patient.
Is there sorry, can I just ask, Jaren, is there a specific like angle that you want to flip the mirror so that no, sorry, not flip the mirror, position the mirror itself? Or is there any landmarks that you choose when you're taking the occlusal pictures to know that, okay, this is the right angulation for me to take?
So my landmark will be from my incisor edge of my upper incisor all the way to the terminal molar.
Okay.
If there's 8 and if I can't get 8, it's usually okay. But I try my best to include the 7.
Okay.
That's my landmark. Yeah.
We always try to at least include the 7s.
Yeah.
So for this, I think this one there's no 7s here. The lower, this one is fine, but the upper here also a little bit harder.
And I try to
Get
ask
it.
the patient, I try to train, especially for ortho, right? You take photos not for one time. You take multiple times throughout your whole orthodontic treatment.
Yep.
So first 1 or 2 times the patient might feel awkward, but I think halfway through you give them the retractor and they know what to do already.
True.
So from the outset, I try to train them to flip to put their tongue to the top so that my photos are consistent. And when you train them for like 1 or 2 visits, the third or fourth visit, they know what to do already. And
Yeah.
after that, it all makes your job easier.
Yeah, that's right.
Mm.
So when you're taking the photos, you're always holding the mirror, right? I mean, it's not the nurse holding the mirror or anything like that.
No, my nurse will do the mirror.
Oh, your nurse will hold the mirror.
Yeah, yeah.
Then won't they like, because their angulation and your position, I mean, their position and your position is different. So when to them it's straight, but to you it's not straight.
I do have
Do you find it hard training them like that?
I can show you a few photos later. I do take
Okay.
a few photos that I can share.
Sure, we'll
I
come
think
back to that.
we move on first.
Yeah, let's move on. Okay, so this is another case, but which is similar lah. So a lot of things that are quite missing and all this kind of thing.
Mm.
For one thing, another thing is how important is it to capture this side of uh the soft tissue,
The front, I mean that
like
buckle
from here?
view,
Yeah.
buckle view, I actually don't really fuss about soft tissue because that will be my frontal shot. Yeah,
Okay.
and again, I think a proper lip retractor would help a
Will
lot
do
in
the
this.
job.
Yeah,
Yes. Yeah,
yeah.
will do the job. Yeah. Okay. Yeah. So anyway, this is the same, but we will go on to how do I go? Okay. We'll go into my own pictures, okay? So
Okay,
we got
it's fair. We talk about other people, then you talk about me, so okay.
wait. Before we go to yours,
Okay,
Jaren,
okay.
we got
Yeah.
we got a question.
Oh, okay, yep. Let's take
How
a
to
question.
prevent fogging?
fogging. Okay. So two ways. One is the cheap way and one is the more expensive way. I think your photo shows some fogging as well.
Yes.
So in some of the clinic that I work, they do have the mini fan where you attach your occlusal mirror to that fan. So when you turn on that fan, there's light and fan that comes out from there. So
Oh.
it automatically helps you to defog the mirror.
Yep, yep.
If you don't have that, I think it used to be very expensive, but I went to a few of the conferences and I see those Chinese uh, reseller, they sell all this. It's very, very cheap money. But I can't be sure how much is it. The other way, if you're cheapskate, then not to say cheapskate, if you want to save a bit, then you ask your nurse to use the three-way syringe to blow onto the mirror when you're taking the photo. Yeah. I do both ways though, because I don't have a luxury of having one clinic where every clinic has that machine. So if they do have, then it's good. If they don't, then use a three-way syringe.
Okay.
Okay. All right. Then we go back to Kutuk my pictures then.
Yeah.
Okay. Okay, so just example case that I do have following up on. Okay, so so as you can see, I do have just a frontal retractor, but I have a different colored retractor here.
Yeah.
Okay, I do use my finger, and my excuse is the same as everyone else, is because it's very faster to do that.
But quite impressive that you are using Buka mirror for all your pictures, because I don't. I find it very, very troublesome.
Is it? I don't know.
Yeah. But it's good lah, because you can take all the way to the 7 or 8.
Yep.
Without
That's
that, then you have to stretch a lot.
Yeah. Also because this frontal retractor, right? It's actually the only retractor that I have. I don't have the, what you call that, the side retractors. Okay, now I do. Before this, I never had. So I had to use the mirror. And then after that I just got used to using the mirror, because I get a better view of the posterior teeth stuff.
I know this topic is about dental photography in orthodontics, but looking at your case, I'm really curious about how your case is going.
Never mind. Don't
Okay,
look with orthodontist eye
see.
yet. Yeah.
I was so curious. Okay.
Okay.
Because in this case, right, I mean, slightly off topic, you have got distal angulated lower 4-3,
Yes,
and your
yes,
3-3 is also distal angulated, which is quite anchorage demanding.
yes, yes.
Yeah, it's okay.
Um,
I'll go
yep.
on.
Okay. Yeah. So this is one of my I don't know if it's safe to say this, but it's my experimental cases with the eye arch wire.
Okay.
So yeah, but let's go back to photography and see whether I got any improvement or not within the few months or not. So yeah, so I still use the same finger retractors and all. But and let me highlight here. So here usually I have to use my finger to pull the lips up here and here,
Mhm.
but sometimes I also fail. So
When
yeah,
is your birthday?
sorry,
When is your birthday?
6th of November.
Okay, I'll get you a retractor then.
Okay, so here, say that I got better retraction here. I mean, I used to try to justify myself
Yeah,
that okay,
this
I don't need a retractor. I can do it with my fingers.
no this bucket shot is really good. Just that your upper and lower occlusal shot needs you need a lip retractor.
Yeah,
Yeah.
yes.
Because
So
looking at your photos here, I think your cheek retractor that you use are U-shaped like that.
yes, that's right.
And then when you retract, you can really retract a lot. If you're not using a buckle mirror, then it's going to be very difficult. I
Mm,
prefer to use the V-shaped one, where it's sharper.
okay,
Yeah.
my
Never mind.
birthday is coming up.
If I can show you all later, then I show.
Yes, yes.
Yeah.
Okay. Yep. Yeah. So I think we can back the slide. Okay. So here, and then going back here. So I know and I notice. Okay. Okay. So this is almost the end of the case. Okay.
Mhm.
But we're not gonna see concentrate, and then we're gonna look at the difference in the color, which I as an amateur, to me, I don't understand why. I don't understand
Oh,
why, because I'm using the lampu, and
yeah.
every case I'm using the same thing. You see, if you see from here, I'm using the same with the same lighting and all. And then I don't know why this picture turns out this color. I don't know if you have an explanation for that.
Well, first of all, you have got a nice selection of cases that I think this is finishing quite well. Um, the only reason that I can think of is you are using your phone to take photos, I suppose.
Yes, I'm using my phone
And
and the lampu
I
light.
I think regardless of whether it's Android or Apple, they set your white balance, means it is automatic. If you use DSLR, right, you can fix that white balance, and that's how you get a consistent color.
I'm quite noob. What's white balance? I'm sorry.
And what is white
No,
balance?
really,
I wanted to ask that as well.
I really don't. I'm sorry, but yeah.
I mean, I'm not really a pro in camera as well, but as far as I know, um, the white balance in the camera is depicted by maybe a portrait, a landscape, or anything. Or you can also change it yourself by the number of K. So the one that people recommended based on whether you are using Nikon or Canon is 5,500 K. So you have to find a specific number you that you like, not that you like, that the color that you like, and then you fix it for all the patient. Yeah.
Does your surrounding light matter?
On that?
Sorry, you go on first.
No, the surrounding light
Surrounding lights.
doesn't matter.
But the
So
flash
I
matters.
have got my camera here.
Okay.
If I can show you, sorry. No, you continue first.
Okay. Yeah. Uh I mean, I realized that sometimes the pictures, the color of the pictures turns out like this, but then like, uh, I mean, someone used to mention that you
Yeah.
just reset your camera or something like that, then you get to you be able to get the colors that you want again. Is that so? I don't know. Ashana, you're a phone user as well, right?
Yeah,
So
I also
eh,
only take photos with my iPhone. Oh, sorry.
can you see
Uh,
it?
yeah,
Yeah.
yeah.
Okay.
It's reflected a bit.
So
What do you want us to see?
there is this K value here that you
Right,
see.
right.
I'm
Yes,
using K 5200.
right.
So this is a custom one.
What
Uh,
camera are you using?
mm, Canon. So you can see that you can choose whether it's cloudy or
Ah, all right, okay.
tungsten light. You can choose it yourself, but for me, I fix it mine at 5200 because I just like that color.
Right, right. So you will have to take like a series of pictures first, and then you choose what you want to set
Yeah,
your
try.
particular white balance at lah. All right, okay.
Or if you attend those dental photography course, those guru will teach you like which is the best for which camera.
Ah, okay, okay, okay.
Okay. Yeah. But luckily, white balance does not matter much.
Yeah.
Yeah, it matters. It matters because I don't think this picture looks nice either. I think this is slightly a bit better. I don't know which one would you guys pick. This is too much, right?
Which one?
This picture
This
compared to
one
this
look,
one,
I prefer the other one.
the previous one, right? This one. I
Uh,
mean, our pictures should sort of look this way, lah.
yeah,
yeah.
yeah. But it's a preference lah, right?
Yeah,
It's
it's a preference. Yeah.
preference. So I was saying actually, Jaren, you asked me whether I also use my iPhone. I use an iPhone 10 and on a lampu. So I also have this issue. Sometimes it is always the slightly darker composition. And then once in a while, it suddenly becomes very bright and flash like this. So
Mm,
I realized, like William said, it probably is because the setting of the white balance of the iPhone is always automatic. It changes depending on your ambient light and stuff. I've realized if you reset your phone and then you restart it again, then maybe it will come back to the original setting. I'm not so sure, but it
Oh, you
happens.
reset the whole phone, not just like close the app and then open again.
Yeah, you have to reset the.
Oh.
Yeah, but better if you get a camera lah. Then you
Mm, mm, mm.
set your white balance.
Mm.
Okay. All right. Let's move on.
Okay.
Okay. I think I'm quite lucky in in this case, right? So okay. Moving on. Okay. So you mentioned that you were teaching, right? And then so students have to consult you in every way. I wanted to ask you, like, is it easier if, let's say, because this is for example of how I do my follow-up cases. So I take it and then
Yeah.
I compile it slide per slide. Is
Yeah.
it easier to judge the case like this or put it together in one slide like that?
I prefer to. It depends on what is the purpose.
Okay.
Okay,
Yeah.
as in,
So
okay.
if you want to see case progression for that arch, then this is the way. But I rarely like people to present it this way because I want to see in all dimension, means occlusal, upper and lower occlusal, frontal shot and side shot. So
So
I prefer,
like that.
yes, I prefer it to look at it this way.
Yep. Okay, I think this is good too. And then, or like
But
this
if you
might be a
have
bit too much.
those that you are showing now is that if you are showing a specific mechanics on a certain tooth or certain tooth movement, then this will be great.
Like that?
Yeah.
Or okay. Yeah. Okay. Okay. Yeah. So okay, if let's say I did not take an intraoral pictures, right? And then I just take it from the model like this and then consult you. Is it sufficient or not? Like that?
Actually, yes. For consultation, actually the study model is sufficient, but you need the extraoral photo as well. So if people are showing just the cast without the extraoral photos, then again, it's difficult to difficult to judge.
What's the difference?
Because facial photo shows you the skeletal pattern and also the soft tissue component of the mouth occlusion, where for study model you only see the dental component, which alone shouldn't be enough to treatment plan a case.
Mm, okay. All right. So for
Yeah.
this case, I did not have an intraoral picture. Okay, so this is just a new case that I showed. Okay, now see. Okay, I just want to see how badly my pictures is as well. When I first started, this is how I take my picture, and then just cut like that. Okay, but I have improved. Okay, I have improved well from there. Okay, let's move on. Not. Wait, let me delete this thingy. Okay.
Nice case, nice finish.
Oh, thank you. In regards to after the bonding, right? I have this case that I still follow up even after this is just debond, I think. Let me see. This is just that, so 6 and 9. Yeah, so I debonded on the month 9, and then I follow up a year later. It's not 1 year, not 1 year, 9 months follow up. How is it necessary for us to still take follow-up pictures even after like a year or two?
Yes, for me, every time the patient sit on my chair, if I have got the time, then I will take photo. Because your follow-up photo pictures actually shows how successful your cases are, because it shows not only the mechanic that you have used but also the stability and the retention phase of the particular case. So follow-up photos are quite important. Yeah, because
Okay.
you want to know whether the mechanic that you have implied is stable or not. But most of us, when it is not stable, when we do something that is not stable, we always blame it on the patient. Say, "Oh, you didn't wear your
Never wear
retainer."
retainer.
But you are giving patient something that is very difficult to retain. Then, well,
Yeah,
I
yeah.
understand that, not every patient wants the ideal treatment plan, and as such, that's very difficult.
Okay.
Mm.
Nice. Yeah, makes sense. Makes sense. Okay, so I think that's all that I have. So
Nice case.
thank you. I think I have successfully camouflaged my fingers here and there a little bit.
Or you cropped it nicely lah.
Yeah, I see. Even for the side pictures, right? For the side pictures, I try to crop it as much as I can, except for the closer pictures, like it's a bit harder. But I will show you evidence that I got used retractor. Okay, let me show you. Just one
Nice.
very before we go to the proper one. Okay, can you see?
Yep.
Okay, so I do have like more intraoral pictures here. Okay, so right now I'm using the side retractors here. So I use 2 side retractors to take my shots, and then this one is just even though the buckle shots also, I'm using the retractor here because I can get it. It kind of makes me lazy to use the mirrors though, but in a way I think I still kind of prefer mirrors still. And nah, see, I got retractor here. See this?
Yes.
Yeah, and you know what happened after I took pictures for her, right? For this case, right? The next day, my nurse lost my retractor.
Oh my God.
It's okay. It's very
So,
cheap, Jared.
but yes, I know. So
Yeah.
I will be getting new retractors. Okay.
I got a question from the floor.
Yeah.
Do you edit your photos through your phone, or do you use a software? Let's start with you first, Jared, and then we learn.
I don't edit my pictures at all. I just or unless you say that flipping the pictures and cropping it, that's all done in the phone. Then yeah, upload it into my computer and then I put it on. So I only use my phone.
How about you, Wilun?
For me, just flipping and cropping, nothing else, not the colors.
So
not the
basically all the colors, the white balance and all that, you just allow, for you, Jaren, you just allow your phone to do the settings, and then Wilun, you will try and find a setting that you are comfortable with, and then you just
Yeah.
allow it to be like
Yes,
that.
it's safe. We don't have so much time to
No, no,
To
we
edit
don't.
the color of the pictures.
yeah.
Yeah.
Okay. All
Okay.
right. Okay, so I will stop sharing my screw ups. So and we'll move on to Weilun for you to show, I think, some certain example of cases that with proper retraction and all. I think that would be great.
Yes.
You see,
Um,
specialist level punya pictures, okay?
no,
Just mere
don't.
peasants.
No, I'm also still learning, so don't talk about
Nonetheless, you do have the proper equipment lah, compared to Jaren and I. Both of us
Uh,
we just use lampu and we use phone. So
I mean, yeah,
but we take photos lah, nonetheless.
it's good lah, rather than not taking. I'm just gonna show something. So I'll show you this one. Okay. Can you see?
Yes.
Yes, we can see.
Yeah. How do I remove this? Okay. Okay, so these are the things that I use. How can I just close this up?
Yeah, just press the yes.
Okay. Can you see?
Yeah, we can see.
So these are the gears that I am using. You don't have to use this, but I'm using a Canon R8, which is a mirrorless. I just got this R8, and it's not because I want something fancy or not. I went in and I wanted a DSLR, but then the guy told me that eventually, maybe in 5 or 10 years' time, they will phase out DSLR and there will only be mirrorless in the market. And if you're buying a lens that fits DSLR, probably in the future you will need another adapter to fit into your mirrorless camera. So since I'm buying the whole set new, that makes me think if I invest on a mirrorless now with a mirrorless lens, that will last me quite a bit. So, and that's the reason why I got the mirrorless R8.
How much first?
I think the body is about 4,000,
Oh.
and the lens I got it secondhand. Okay, I think as long as it does the job, it doesn't really matter.
Okay.
But a full frame camera should fit into a 100 mm Canon lens.
Okay.
Then before this, I used to use the ring light, like the one that I show on the bottom left. Now I'm using a twin flash, which is the one next to it, a Godox twin flash. That cost me about, I think, 1,000 ringgit. The whole setup is not more than, I think it's just about 10 grand.
Okay lah. One ortho case will pay for that lah, right?
Not really.
Not really.
Yeah. Then if you look into the photos on the right, you can see that actually Godox have just released the bracket. So what's the use of this? It allows better light to go into the buckle. I think it is more diffuse. It's more diffuse.
Right.
The problem with a lot of people when they use a twin flash is if you are doing it for orthodontics, not for restorative, then the buckle shot can be quite dark.
Right.
Okay, and that's not what we want to see.
Right.
For ceramic cases, restorative cases, they don't mind because they just want to focus on the front 16. So the angulation of that twin flash is quite important, and it took me quite a while to understand, like, if you want to take intraoral, then you have to angle your light inwards towards your lens. And if you are taking extraoral, then you have to angle it parallel to the lens.
Inwards to the lens.
So
Okay.
like if you see the photos on just below the 100 mm lens, the angulation of the twin flash is parallel.
Right.
Yep. Yep.
Yeah,
So
that's
this is for
usually for
extra.
extraoral. Yeah.
Right, right.
And if you want to take for intraoral,
This will be
usually
towards
do
the
it like
lens.
the Sony one, which is angled into it.
Ah,
Yeah.
Okay.
And
okay.
that's how you reduce the black buckle corridor.
Okay. Then okay. Some old question lah to ask you. Why
Mm.
Canon? Why not Nikon? And why not Sony?
I have been using Canon since I got my first camera. So before this, when I was a GP, working in a private practice, I was using a Canon, I think 70 or 70, I forgot already, which is very, very old.
The
And
EOS FT lah.
yeah, and that was from my dad's one. So then I'm used to it. During my training during my specialist training, we use Canon as well. Doesn't mean that Canon is better, just that I'm used to the interface, I'm used to the color,
Okay.
and I just want to stick with it.
Okay. Okay. Understood.
Yeah.
So
Yeah.
not better or anything lah. It's just
No.
preference because you have used it before. Okay.
Yes. Yeah. Then the one that I'm using, the one on the far right bottom corner, which is called the fixed light. You can see that it is quite bulky,
Yep.
but it gives me the diffuse light that I want. So I'm going to show you a few photos that I've taken, and then you can judge me yourself. I mean,
Okay.
disclaimer, again, this is my own cases.
Okay. Then we got another question. Sorry, before you show
Yeah.
your picture.
Yeah.
How do you store your DSLR? No, your mirrorless camera right now. And how do you keep it? Is there a special box? Because this person is afraid of fungus, which
Oh,
we
yeah.
have heard really can
Yeah.
attack the lens. And there's no way you can get rid of it, apparently.
If you are storing it at the place where it's hot and cold, then it is more susceptible for fungus infection, not infection, for
Fungal growth.
fungal growth. Yeah, sorry. For me, I have a camera bag. I forgot what's the brand of the bag already. It is specifically used to store camera and lenses, and
Oh,
it doesn't mean that that bag will prevent, but apparently it reduces the chance of
okay.
fungal.
It has
Okay.
its like compartments and slots lah, right?
Yes.
Okay.
I think as long as you don't bring it, like you don't leave it in the car, then bring it to the aircon room, then bring it to leave it in the car again, then I think it should be fine.
Good to know. Good to know.
So because of this talk, I took a few photos with my nurses, and this is how I usually set up. So my nurse will hold, for frontal shot, my nurse will hold the cheek retractor, and that is my position.
Okay.
Okay, and at the same position.
Do you change the slide to the next slide already?
Yes.
Oh, it's
We
not.
cannot see.
We cannot see yet. Hold on.
Oops.
You change the slide, then you. Okay. There we go.
Okay. Can you?
Yes.
Yep.
Okay, so this is how is my position. So I have my nurse to retract, and I hold my camera. Then let me know if my slide is changing.
No.
No? Okay, now I need to go out and... Are they?
Okay.
So the upper photos and the lower two photos, the patient is in the same position, except I just ask the patient to face me, turn the head towards the right, and turn the head towards the left. So these three photos already in my frontal shot, my buccal shot, my right and left buccal shot.
Nice. Easy.
And when I do my occlusal, my nurse will hold. Can you see that my nurse is holding the devices?
Yes.
That device will have light and fan coming through.
Oh.
Yeah, and it's I think it's battery or chargeable. I'm not very sure. So she will hold my lip retractor, and the first photos on top and the second photos, they are you can see that when I'm taking the lower occlusal, I ask the patient to tilt her head all the way up.
Yes, yes.
Yeah, and that's how I can see and make sure that my lens is parallel, not parallel, perpendicular to the occlusal mirror.
Okay, okay, okay.
Yeah.
This makes sense.
So my job is quite simple. My nurse, I have to thank them. They do quite a brilliant job in retraction. So if you look at my cases, the retraction are done by my nurse. My
Yeah,
job, my job is just
proness,
my job is just
proness.
kick the shutter.
Do you
Your
ever
position doesn't really change, you're just
ah
I
standing
don't,
there.
I don't,
Yeah.
I don't. Yeah, yeah. So these are the few photos that I taken.
Damn, look at the color.
So so you can see um the frontal photos. I usually want to see a bit of the buccal
Yep.
corridor, and the occlusal photos I usually want to see possibly the last terminal molar.
Mm.
Yeah.
okay, okay.
Okay. And if you notice, you see that the color is very nice. But if I were to critique my own photos, I can see that there's a lot of saliva there, which
Yeah.
for me, I
Yeah.
a bit icky. Like, for me, it's a bit girly when I see the photo. So you see the saliva there, I prefer. But sometimes, you are rushing, right? For me, like, you got no choice. But if given time and choice again, I would really like clean the whole surfaces out.
Okay.
Mm.
Mm. Then my last photos is this one. So in terms of sharing your normal bike photos, I try to also take uh the middle photos, which is slightly opening up.
Mm.
That's the one on the upper center. And that actually is to show if in cases where there is a lot of displacement and also your lower incisor, whether they are aligned or not, your center line, and that's very, very useful.
How deep
Yep.
the curve of P is and stuff like
Yeah.
that. Right.
So, yeah, that's it. I
Everything
haven't
is so bright.
I haven't cropped all these photos though. So if I were to post it or to publish it, then I'll probably crop it just the teeth, so we can eliminate the mesi and also
The
the
retractor, the major part of the
yeah
retractor.
yeah yeah yeah
Okay,
Do you
okay.
do you think that the occlusal pictures are a little bit darker?
Yeah.
yes. And this photos was taken when I first just started using the twin flash, and I don't really know how to operate them yet. And
Ah.
hence, and because of my ISO and my flash setting, the occlusal mirror shot looks a bit dark.
You mentioned that the device, right? You say got fan and then they got light, right?
Yes.
Then because the device got light also, then yours also got light. Will it affect much?
No, it doesn't. It's purely from your camera setting.
Oh,
Yeah. Okay. So, uh, that's it.
yeah. Yeah. I think we
So
are
to summarize, you don't, as a consultant orthodontist, you wouldn't mind the quality of the photos lah. As long as there are photos, it's good
Yep.
enough, right? Right. But of course, if you want better photos, you would suggest them to go for a DSLR or mirrorless with a flash system, like at least.
If they want, because regardless, if that's your own case, I think it's good to keep a record. You never know that if you are going to do any publishing or if you are invited to do any talks, you never know. Even if you're a GP, there might be a chance that you want to compete into some competition, like best case for uh best case for MPDPA or something like that. Yeah.
mm,
So you never know. So if you have good photos, then probably you can try. If I am the judge and I see the blue gloves everywhere, then it turns me.
Okay lah.
A white glove, not that obvious, right? See, it
Ah,
doesn't annoy you, right?
yeah.
But yeah, I think with the retractors, it really does look better lah. Now that I've taken one myself, right? Actually, I feel, oh yeah, retractors it really looks better. But it went missing, so what to do? Okay.
It's okay. I'll get you one during your birthday.
Thanks, Wilun.
All
Thanks so
right.
much, William.
Okay.
Yeah, so I think that's the end of today's talk. I think we had a little bit too much fun, and I think this is great.
Yeah.
So Shana, so just pass the time to you to wrap us up.
Yes. Thank you so much, Wilun. Thanks for actually taking time off your busy schedule.
Ah,
Talk to us about photography. I think we went through Jaren's pictures of how and Jaren's friends' photos of how photography can be so different when it comes to how you retract, what kind of flash systems you're going to use, whether you're going to use an iPhone or any other phone towards mirrorless, as well as a proper DSLR with flash, also using retractors. So thank you so much. This is our first ever Buka Mulut live talk show. This is held by GDPA, which is General Dental Practice Association. I'm sharing you guys a link on the chat room. So if you guys are interested, next month we'll be having another one with a different topic, and hope to see many of
okay.
yeah. Next month, Jaren, do we know what we're talking about? I don't think we have
We'll be talking about next month we'll be having Dr. Angi
oh
will
yeah.
with us. Yeah.
All right, okay. But we don't know what she's talking about yet, right? It either is splint or prosto, but I think we'll let Angi tell us later.
Okay. All right.
Everyone will know.
Yeah.
Yeah.
Do sign up.
Our GDPA membership is paid, but then our Buka Mulut talk is free for all. So
Yeah.
do join us because GDPA is still new, and we will be having more, not just this live talk.
We'll have
Under
other
our GDPA, we have a lot of other events also
Yes.
in the future. So yeah, do hang out with us and sign up for it.
Yep. That's it. So thanks,
Thank you guys. Thanks
Okay.
for
All right. See
your
you.
time.
Okay.
We'll
Good
see
night.
you all in the next episode.
Bye.
Bye bye.
Bye.
And where do I offer recording?
I
Stop
don't know.
recording.